I'd like to ask for your help as our ICU is full. 50% of the patients in this unit are COVID-19 positive, and 100% of them are on vents.
You just heard from Hendrick Medical Center CEO Brad Holland reporting their ICU is full. Here's a live look at the Johns Hopkins University map. Coronavirus numbers across the U.S. continue to rise, including right here in Abilene. And local hospital officials believe our community has relaxed when it comes to COVID-19. Once again, they're asking you, the community, to help stop the spread. But will people take it seriously? KTexas reporter Nick Bradshaw kicks off our team coverage.
COVID-19 continues to surge right here in Abilene.
I'd like to ask for your help as our ICU is full.
Hendrick Medical Center CEO Brad Holland releasing an audio recording asking the community for help.
This surge of hospitalizations will result in stretching the resources and capacity of your local hospitals.
Holland says we've become, quote, relaxed. The clock now ticking. ICU beds are full. The hospital calling it community spread.
If I look up a news article, it seems like there's the opposite article posted right next to it. And so it's really hard to know what is true.
Over the last several months, false information has gone viral on platforms like Facebook and Twitter.
Things have come out in the last 2 weeks to really make me question what is true and what's not true.
Both vowing to flag misinformation. Sometimes after thousands of shares, it's too late.
The lack of accurate information and consistent information is concerned. That's the most concerning to me. I have a friend that's died from it. I have friends that have been very sick from it, but I don't feel like overall it's more dangerous than other things that we've faced. And so I'm probably not as scared of it as some people are.
I'm 78 years old. I should be afraid, huh?
With conspiracy theories and COVID fatigue, healthcare officials are facing an uphill battle.
The majority of people walked in the restaurant didn't have masks on.
As we head into the winter months and live out our daily lives, for some, the fear is real. Hey, why should people take it serious?
Because you're going to get sick and die.
But a lot of people don't believe that.
Well, there's a lot of people who are dead that didn't believe it too.
Scientists say it's a fact wearing a mask and avoiding large groups will help slow the spread.
So if it truly is a health concern and if it truly is filling up the hospitals, I think my first question would be, is Abilene using the therapeutics that are around the country that are working?
Hendrick Medical Center says the answer is yes.
I ask that you come together and help your local caregivers beat this pandemic.
They're begging Abilene to do the right thing. Nick Bradshaw, KTexas News.
And Hendrick is collecting convalescent plasma from recovered COVID-19 patients. And for more information, go to our website, ktxs.com. And continuing our team coverage tonight, the flu and COVID could make this season a dark fall. And those in the medical field pleading with the public to wear masks and continue practicing social distancing. A place typically for touchdowns, now where you can get your flu shot. Hendrick Medical Center's Dr. Rob Wiley.
And so I think the masking and the social distancing will not only be helpful with the COVID, but it will be very helpful with our flu season.
This past March, Dr. Wiley says flu cases started to increase. But when the pandemic hit and we started masking up and social distancing, the flu dropped.
Which is remarkable. So what is going to be interesting to watch for this season, since we're already masking, we're social distancing, is that going to decrease the volume of flu that we will see? And the answer to that is probably yes.
Another fear? Getting COVID-19 and the flu at the same time.
Will probably not be uncommon. Then you're going to have two viruses attacking your respiratory tract at the same time.
And the Abilene-Taylor County Health District reporting 114 new cases tonight, the second highest one-day total on record. There were also 2 COVID-19 related deaths, both women in their 60s with pre-existing conditions. Active cases soared to 1,101, with 33 of those people hospitalized tonight. And the San Angelo Health Department reporting 52 new cases of COVID-19 in Tom Green County tonight. 2 more people had COVID-19 related deaths, a woman in her 80s and a man in his 70s, both from outside of Tom Green County. Tonight, the total number of active cases sits at 423, with 32 people hospitalized.